Today, we are covering the head-to-toe physical assessment, specifically how it is tested on the NCLEX. The exam will not ask you to simply list the steps of an assessment. Instead, it tests your ability to perform the steps in the correct sequence, identify the most critical finding, and act on it. A classic exam question will test your knowledge of the 4 main assessment techniques and their proper order, which is inspection, palpation, percussion, and auscultation. However, the most common trap and a guaranteed exam topic is the major exception to this rule, the abdominal assessment. For the abdomen, the sequence changes to inspection, auscultation, percussion, and then palpation. This is because palpating or percussing the abdomen before listening can artificially change the character and frequency of bowel sounds, leading to an inaccurate assessment. The NCLEX loves to test this distinction. You might see a question that asks, after inspecting the client's abdomen, what is the nurse's next action? The correct answer will always be to auscultate. To remember the correct abdominal sequence, use the mnemonic I Am Perplexed PAL, which stands for inspection, auscultation, percussion, palpation. The exam will also present a clinical scenario and expect you to identify the most significant finding. For instance, a patient with a history of heart failure reports shortness of breath. During your assessment, you auscultate new-onset crackles in the lower lobes of the lungs. This finding is the most critical piece of data because it indicates fluid volume overload, a serious complication. The NCLEX will test if you can distinguish this from less urgent findings, like a 1+ pitting edema in the ankles, which is also a sign of heart failure, but not as immediately life-threatening as fluid in the lungs. Another common exam trap revolves around documentation. The NCLEX requires you to choose documentation that is objective and factual, not subjective or interpretive. For example, if a patient has a head injury, a poor charting choice would be patient seems confused. An excellent exam passing choice would be patient is alert but oriented only to person, unable to state location or date. This is a measurable, objective finding. Similarly, for a neurological check, discovering that a patient's pupils are suddenly unequal and non-reactive to light is a critical finding that must be reported immediately, and the exam will test your ability to recognize this as a top priority over, for example, checking their peripheral pulses. The entire purpose of the head-to-toe assessment on the NCLEX is to find the piece of data that signals a change in patient condition and requires immediate nursing action. Master the correct sequence, especially the abdominal exception, and focus on identifying the most abnormal and life-threatening finding in any given scenario.